Hey folks, just a heads up. This episode discusses mental health conditions, suicide, and substance misuse. As always, please listen at your discretion. If you or a loved one need support, you can call or text 988 and connect with a trained counselor. Hi, I'm Calvin Pugh, and this is HIV Connect, a podcast from the International Association of Providers of AIDS Care, or IAPAC, that brings into focus what living with HIV looks like today. In each episode, I connect with clinicians, experts, and community leaders in conversations about clinical and psychosocial management issues such as aging, stigma, and sexual health topics that matter to people living with HIV. This week's episode is all about mental health for people living with HIV, and I'm joined by Dr. Remian, who's a professor of clinical medical psychology and director of the HIV Center for Clinical and Behavioral Studies at the Department of Psychiatry at Columbia University, and area leader on the Division of Gender, Sexuality, and Health of the New York State Psychiatric Institute. As a researcher and clinician, Dr. Remian has considerable expertise in the development and implementation of interventions designed to improve HIV care and mental health and reduce sexual risk among vulnerable and disadvantaged populations. Dr. Remian has conducted behavioral research at the HIV Center for over 35 years and has been involved in HIV volunteer work, clinical work, and community mobilization and advocacy since the early 1980s. And Heather O'Connor, who is a woman, wife, and mother living with HIV, diagnosed in 2016. She currently serves as communications specialist for Ribbon, a nonprofit organization that supports service providers and individuals to help facilitate positive experiences and healthy outcomes within public health systems. Heather is also the program coordinator for the Reunion Project, the National Alliance for Long-Term Survivors of HIV. Heather is a community advisory board member for the WELL Project and also sits on the perinatal guideline panel. Heather is the founder of the Milky Movement Plus, a supportive network for mothers and birthing parents with an interest in breast and chest feeding. In recent years, there's been increasing awareness of the important role mental health plays in our lives, as illustrated by the inclusion of mental health as a priority in the United Nations Sustainable Development Goals. Depression is one of the leading causes of disability, and suicide is the fourth leading cause of death among 15 to 29-year-olds in the United States. COVID-19 pandemic only served to exacerbate mental health conditions, including among people living with HIV. Additionally, though, people living with mental health conditions often experience discrimination and stigma that pose barriers to accessing and utilizing evidence-based mental health interventions, both cognitive and therapeutic. In this episode of HIV Connect, we will explore the critical role of mental health in the lives of people living with HIV. Thank you both for joining me. So how do you both define mental health? And Dr. Remian, can you provide both your personal and your professional definitions?
Well, yeah. I mean, look, essentially mental health is we're talking about, one's emotional, psychological, and sort of social well-being. Our mental health affects how we act, how we feel, how we behave, and ultimately it will influence or affect how we handle stress and the kind of choices we make in our living, in our lives.
I think it has a lot to do with one's ability to cope with day-to-day activities and happenings in a way that is healthy and in a way that is not detrimental to someone's health. And, there's a difference between good stress and bad stress, stress being a motivating factor that helps you to get through the day, but then there's bad stress that can break you down, mentally, emotionally, and physically. So I think that, a healthy balance of being able to just, make good decisions for yourself and look out for yourself and really know yourself.
That's so important. So what are some of the most common mental health related issues among people living with HIV? And why is there such a high burden of mental health conditions?
Yeah, it's a great question. I think it's a combination of factors. The most common that we see, at least what the literature, tells us about both people living with HIV, but also those at risk for acquiring HIV, include mood disorders, particularly depression, but also anxiety, and then also post-stress-related disorders, including post-traumatic stress disorder itself, but even that kind of symptomatology. And I think it's a combination of factors in terms of why it's so prevalent in this population. I think more broadly, beyond HIV, I think people who have mental health backgrounds or issues in their life, and remember, mental health can be influenced by biology, by family history, but also by life conditions and traumatic experiences. So that anyone who has that in their background is probably more vulnerable to various health conditions. And then vice versa, health conditions can influence or bring on mental health conditions. So those are the kinds of things that we tend to look at in this population. And of course, because we're talking about behaviors, there are issues around, for some people, also to include in mental health, use of some substances, including alcohol and other substances.
Heather, for you and in your work, you've been really open about your mental health. Could you share some of your experiences and maybe some of that?
Yeah, absolutely. I think that mental health for me has been an issue for my entire life, but I don't think it was really brought to the forefront until I was diagnosed with HIV. That was the first time that I was ever put on an antidepressant. I just felt it was an extremely traumatic experience getting an HIV diagnosis, and it was really hard to shake that and to, continue living my life in a way that I was doing before. It completely changed everything for me. So I ended up starting on antidepressants, which actually didn't sit well with me because the HIV medication that I was taking at the time had a component in it which elevated the levels of drugs in my body. And so I kept feeling just out of sorts. I was depressed. I didn't want to get out of bed. I didn't want to eat. I didn't even want to sleep. I didn't want to do any daily activities that I normally would have wanted to do. And so as a response, my doctor kept upping the dose of my medication. And what was really happening was there was an interaction between the medication, the antidepressant that I was taking, and my HIV medication, which made me very sick. I presented with other issues as well as, nausea and worsening depression. It just wasn't getting better for me. So that was a big issue for me. And I ended up starting therapy at that point pretty regularly when I could. Insurance doesn't regularly cover that. It's not very accessible. So I did what I could. I went for a mental health evaluation probably after having my son. He's 2, so 2 years ago, and I actually left the appointment with a diagnosis of bipolar disorder, anxiety disorder, generalized anxiety disorder, depression, and moderate alcohol substance abuse or addiction. And so those are things that I have juggled in my life, tried to figure out. I'm on medication for the bipolar disorder. I'm on medication for depression. I've tried various medications. I've been on almost everything and, had some really negative outcomes with a lot of them. But I finally feel like I do have a regimen which allows for me to be pretty consistent throughout the day. My biggest issue is my mood swings and my inability to be able to process things. When something happens to me that is considered stressful to me, I just have a huge change in my mood, and I become just engulfed in all of these feelings of negativity and panic almost. And then my thoughts get very obsessive, very repetitive. And it's like a trap for me. It's really debilitating for me. It makes work hard. It makes daily life hard. It makes relationships hard. But I just try every day to find ways to just, utilize breathing, utilize just being present in the moment, and, whatever meditation looks like in that day. It's not necessarily sitting down and taking some quiet time. I have 2 young children and a full-time job, so that doesn't happen too often. But yeah, I've really struggled. But I'm on an upswing, I think. So
And I think it's so courageous that you've been so open about that. I know sometimes you get tired of being called brave and courageous, but I think, it really struck me when I was reading your writing. It was so powerful.
Yeah, I also, if I can, Calvin, I appreciate actually you sharing your story like that and the details. And among other things, I mean, you're pointing out a lot of things, but among other things, I think you're pointing to what people should realize and understand is this interaction, interplay of kind of biological and what we think of as psychological factors, right? So environmental happenings in our life experiences can trigger mental health consequences. But there's also an interplay of biology. And you talked about the medication. And so for people to understand that psychological conditions have both biological and sort of environmental substrates to them, right? And there's an interplay and interaction of each affecting the other in both directions of what's going on in our life and the stress and the trauma we experience, but also what's the underlying biological conditions. And that comes, as you talked about, comes into play when we're talking about treatment and interactions, for instance, of medications and things like that.
I want to say that Heather said about access, because what are Dr. Remy and maybe Heather can speak to more of your personal experience, but what are some of the major barriers people living with HIV face in fully engaging in their care if they're also living with mental health conditions?
Oh boy, it's such a great question, because I think there are so many barriers. I think, in our country and, well, really across the globe, right? There's a lack of parity, a lack of, I think, generally, of equal attention to mental health as there is to physical health. And it's so ironic. I always say, the brain is part of the body, right? The brain and body are one. The mind and body are one. And they're treated in a siloed nature. And then the mental health conditions are treated somewhat separately and feeling like, a primary care doctor or a nurse doesn't want to take care of mental health, that you have to go someplace else. So our structures set up barriers, right? And then there's also, unfortunately, there's stigma related to mental health and even talking about it. And then we have HIV stigma. We have stigma for some people with racial identity or gender or sexual orientation identity. So these intersecting stigmas get in the way. I think the lack of resources and care for mental health conditions and the lack of routine, even checking in on one's well-being. I'm always advocating when it comes to like primary care, all of primary care, but especially HIV primary care. Doctor wants to know CD4 count and viral load and things like that for people living with HIV. Well, just as routinely as that, normalizing and routinely checking in on their well-being and their mental health and making that something that, we ask everyone is how are you doing in your life? And, your mood, your cognition, and all of that. So moving towards routinizing it, because it's a barrier that we treat it differently, I think.
Yeah, I would say I totally agree with that. And I also want to point out that someone who is in the middle of a mental health crisis is not likely to reach out for help, so that's also something to consider, and something that I always say. It was very stigmatizing to be diagnosed with HIV. It took me a long time to come to terms with it. I work in the HIV field. I live with HIV. It's in my face constantly. And sometimes I want space away from it, but it's my reality. And I've been able to find a way for HIV to live with me and to, put up with me and my life and my choices. And so being hit with that bipolar diagnosis on top of that was extremely stigmatizing for me as well. But I also live with a lot of privilege being a white woman in the South. Oftentimes when I share my story of being diagnosed with HIV, I get the same response, like, oh my God, you're so, like you're saying, Calvin, you're so brave, you're so courageous. How that's so awful that happened to you. But you look at, a woman of color or someone of a different gender identity, and it's almost like, well, what did you do? What did you do? I've heard that before. And I sit in a place of a lot of privilege, and I just speak to that as often as I can, because I try my best to utilize that privilege to speak up and to acknowledge that in spaces like this where we're having these conversations, because mental health access is not as easily accessible for other people as it is for me as a white woman.
That's very true. I think something for all of us to, really ponder when, I'm with you in the courage and the brave comments. They get a little tiring after a while, but, you and I have a significant amount of privilege, being a white person in this world, and things are certainly often more accessible for us. So we've talked about, Heather, some of the traumatic moments for you, and I think it's really important to ponder what are the effects of traumatic situations, persistent stigma, even the aftermath of the COVID-19 pandemic on mental health conditions in people living with HIV.
Yeah, it's huge. A diagnosis in itself, just learning to live with, HIV, there are things that you must do. You must take your medication every single day, to get and stay undetectable, to keep yourself healthy, eat healthy. The pandemic was absolutely huge. Personally, for myself, I lost my job during that time. I was doing in-home ABA therapy for children living with autism, and you can't go into someone's home if COVID-19 is, running rampant, everyone's staying inside. And so I had no job, I had no income, and all I had was a credit card that I was maxing out every day because I needed to eat. I needed to feed my kids. I needed all of that. And that just put so much extra stress on me that those feelings and those thoughts and those worries about finances and how I was going to get through day by day and do so in my home. I gave birth during the pandemic as well. That was huge. And so it was a very stressful time, and I didn't have time to really think about my mental health and how I personally was doing. I wasn't checking in with myself. I was very much going through the motions and making sure that my kids were fed and taken care of. And then, there were days where I'm like, did I take my medication? And I'm totally going to be transparent about it as well. Drinking became a problem for me. That was an issue for me. And I worked out like the perfect routine. Something about my journey is I was supported by my provider to breastfeed. And so I breastfed both of my children, and I had it completely down to a science, like pumping, having the bottles ready and everything so that I could have my glasses of wine at night. And it got to the point where that was like a very obsessive thought for me. And I pondered that throughout the day. When was I going to get to that point when I could exhale? Because that's what it felt like for me. And then I just woke up the next day not feeling well. And so it just started the process all over again. And I was just trying to find a way to find some peace, to find some, centering. And it was very, very, very difficult for me, very isolating, and it seemed hopeless.
I mean, look, I think the world was affected by COVID, right? And it was stressful. I mean, I think it brought to the attention of the world and the press about our mental health and our well-being. But then think about it, Calvin, and what you're hearing is when there are other co-occurring conditions, right? So I think particularly people living with HIV, a lot of people felt re-traumatized because here's another infectious element out there. And how's that going to interact with my HIV? And, whether it's the trauma of having had an HIV diagnosis or the fear of it being compounded, both physically and psychologically. I think, anyone with another chronic health condition is extra stressed when it comes to something like a COVID pandemic and all the things that Heather referred to in terms of what it can interfere with in daily living and well-being, and whether you do or don't have support, including from your healthcare providers, but also from friends and family. The isolation was really compounding everyone's mental health and challenges So it's all very layered, as we can see.
I mean, as a follow-up, I mean, the world seems like it's on fire these days. The news is bad every day. There's just so much happening at once. So I often really do wonder how much stress we can tolerate and still participate in health-seeking behavior. What are your thoughts?
A large part of the reason why I'm able to cope is my location in the world. I live in Virginia, in the woods, in the middle of nowhere. I'm very isolated. I'm around nature, and I'm able to isolate myself from the news when I choose to. But that's avoidance, and avoidance isn't necessarily the best coping mechanism, and I understand that and I acknowledge that, but that's my honest, transparent truth is I use avoidance. I use my distance from people, and I sort of just close myself off. It's difficult. It's really difficult to be present, to be current in the news, and to find ways to roll with the punches, and to find hope. And having kids is also part of that too. Like, I want my kids to live in a world where it's safe for them to go to school. I want them to be able to feel safe. I want to be able to feel safe when I send them to school, knowing that they're going to be okay, that they're washed over, that nothing's going to happen. But I mean, the news tells you otherwise, and it's very disheartening and it's very scary. It's very, very scary.
Yeah, and Heather's talking about, coping strategies, right? And as she's pointing out, there are positive and maybe more positive, more negative coping strategies. And sometimes it's a fine line, something like, going someplace to be on your own can be a positive coping strategy, right? Especially if something like example you gave of being out in nature. However, if it veers into too much avoidance and shutting yourself off from the rest of the world, that becomes sort of a more negative coping strategy. Someone maybe having a glass of wine to chill in the evening, might fall into sort of that's their coping strategy that day. But if it becomes into excessive alcohol intake, can affect you physically and psychologically. So, we're talking about mental health, but we're talking about well-being. Right. And so for all of us, and we have to think of it, it's on a spectrum, right? Mental health matters to everyone every day, and our well-being from day to day. Sometimes it's just elevated with more intensive conditions. Heather talked about something like a bipolar disorder, diagnosis. And so there are some things that require more intensive professional treatment. But in our daily lives, I think we have to think about how we cope and survive, where we get support, how we take care of ourselves, and how we find soothing and rest and relaxation. And that even what comes into play is also how well we sleep or how well we eat or exercise or just basically take care of ourselves, as well as taking care of children and family and people in our lives. So it's balance, I guess, is a word I want to throw into the mix of how we balance all these things.
Yeah, I have to echo Heather in the needing to be outside. Last year, when the shooting happened in Texas, a friend of mine texted me a few minutes later and said, "Hey, do you want to go camping?" And if you take a good look at me, I look very high maintenance and like I would not spend any time out in the dirt. However, I said yes because I asked, I said, does my phone work there? And he said, no, it doesn't. And I was like, I'm in. Let's go. And for 3 days, I was cut off from the news, the doom scrolling, and the perpetual cycle of just negativity. And I came back a whole new person. So, my family was just shocked that I'd been outside, away from my hairdryer. But what are some pointers that both of you would give to newly HIV diagnosed individuals to take proactive care and optimize their mental health?
I think the first thing that I would say is that you need to give yourself time. You need to give yourself time, and you need to establish a safe place for you to take that time, because it's not going to be overnight that all of a sudden you own your diagnosis. You are able to navigate this life as a person living with HIV, because it changes you. It changes you, and we're so lucky to have the medication that we have nowadays. And, U equals U. If you are undetectable, you're taking your medication, you can't transmit the virus sexually. That's huge. That's liberating. But in the moment that you're receiving this diagnosis, that doesn't mean shit. I remember being diagnosed the day I was diagnosed, and, just being told these medical things that I would have to do as a follow-up. And I wasn't in my body at that point. I was floating somewhere above my body, hearing the sobs of my mother in the background. Like, I wasn't there. And I wasn't there for a while. I had to force myself to eat. I had to force myself to continue living. There was suicidal ideation. It's rough. It's really, really hard. And so, support system is huge. Even if that person can't directly relate with you, if that person's not living with HIV, just having someone like sit next to you and not say anything. Just make sure, like, are you eating? Are you, do you want to take a shower? Do you need food? What can I do for you? How can I help you? And the sad part of that is, like, not everybody has that. Not everybody has the ability to have a support system, to, be in a safe space. Like, housing is an issue. Some people don't have a house to go home to. They don't have the ability to get their medication in order to, partake in this journey of becoming undetectable. That's not a reality for them. And so, one of the things that I found so helpful for myself is surrounding myself with other people living with HIV, finding opportunities to just be in the same room with them. Like, Calvin, I think the first time that you and I met in person was at Positive Living last year. That was last year. And that was my first experience of going to a conference and sharing space with other people living with HIV. And it's such this, like, unspoken bond of just, you understand. Like, you get it, you get it. You get that part of me that so many people will never be able to understand. And that made me feel held, and it made me feel safe. And I just felt the love and the support. And so, finding resources like that, like the Well Project was extremely helpful for me and gave me a family and gave me community, gave me an opportunity to blog and share my story. And so finding connections like that, I think, is truly so important.
Yeah, I think, Positive Living is unique in that way. Positive Living is a conference in Florida. It is run by people living with HIV, with only people living with HIV. I think there's something very powerful about an unspoken Me Too.
Absolutely.
Yeah, I think that's very, very important. And I think Heather really just touched upon all the right points of advice. My first response would have been similar to yours. You said, to take time. And I thought, first thing is to take a deep breath, and give yourself time and give yourself permission to be on an emotional roller coaster, because it's it can feel overwhelming. But I think what you emphasize is so important is the support and for support around you in whatever way, which doesn't mean, I always try and, doesn't mean you have to go out and pronounce your HIV status to the world. Some people think, you need to disclose it right away all over the place. No, it's your information. But you want to find a safe space, as you said, a safe environment, a safe room to start to talk about. And it's very powerful to be with other people with HIV, that's for sure. I think we all experience that, yeah.
Yeah, and I think as someone who did very shortly after their diagnosis tell the whole world, I didn't, I agree with you, Dr. Ruben, that, take your time. Yeah. Not everyone has to be an advocate from 5 seconds.
Exactly.
You can take the time and heal yourself, because the best version of anyone's when they're healing. So why do you think the topic of mental and consequently seeking services is so stigmatized? And what can we do to reduce that stigma?
Wow, that's a loaded question.
I've only got tough questions, so sorry.
Yeah, no, it is a tough question, because just as you were saying, like, you don't have to disclose your status 5 minutes after being diagnosed. I feel like when I was diagnosed with HIV, as time passed, I reached a point where I decided that I couldn't live with this virus unless I was open about it. Like, I needed to live in my full authentic self. And that's why I chose, I have a background in dance. I trained as a dancer my whole life and like went to school for that. And so I made a video, like a movement video of me moving to, some music. And then I wrote like a long explanation disclosing my status on social media. And for me, when I received my bipolar diagnosis, I had that same reaction. I just needed to get it out. I just needed to like let people know. And like maybe that's part of my own insecurity, that I felt like I couldn't live with it in a way that I was confident because I was keeping something from the world. I don't know. It might be a character flaw of my own, but that's just what my experience was. But especially living with HIV, receiving a mental health diagnosis on top of living with HIV, it can make you feel like you're broken, like something's wrong with you. You're like, damn, I just got, over this HIV diagnosis, and now someone's telling me like I'm living with bipolar disorder. Like, how do I navigate that? I didn't even know anything about it at the time. I think I also surrounded myself with people living with bipolar disorder. That was my response. I found support groups. I shared my story. I listened to other people's experiences, and it made me feel not so alone. And I'm lucky enough to have the technology to be able to do that. So I think that's how we combat the stigma, is by creating community and really uplifting the individuals who choose to share their stories and their experiences, and celebrating that. And celebrating each individual's journey into finding their true authentic self and living within their truth. And, because life's hard, man. Like, life's hard without living with HIV, without living with a mental health diagnosis, but navigating these things within it all makes it even more difficult. But aligning with other human beings who have the same experiences with you can make you feel like, okay, someone's there. It's that unspoken me too. I think that's the theme of it. I think it's that unspoken me too is what we want to get to.
Yeah, I think that's part of normalizing and overcoming the stigma, right? And with your question, Calvin, it's telling one story, sharing one story in their own way, in their own time, and everyone's different, and you have a wonderful example, Heather, of doing the dance and going, that was you, that was your style, your way of expressing. Everyone will have their own way of expressing in their own time. But also, I think the more we talk about all of these things, that I think that can contribute to destigmatizing, be it a mental health condition, an HIV diagnosis, or any other illness that someone's coping with, is finding other people and talking about it. We all have our vulnerabilities. We all have things going on. We all have shit going on in our lives. And I think, normalizing being able to say, I'm in trouble. I'm struggling. I could use a little bit of extra help right now. The more we can normalize that. I don't know where this notion ever came that we're all supposed to be, strong and not have any problems and fix it on our own and don't complain. Well, we all got to go through stuff, and the more we can share and talk and support each other, I think the better the world will be.
So finally, what are your thoughts regarding advocacy for the human right to the highest attainable standard of mental health?
Well, I just want to say that it's extremely inaccessible at the moment. I personally was going to therapy regularly, weekly, via telehealth, because I had met my deductible for my insurance because I had oral surgery that year. So I was, in my routine. I was good. I was going to my therapy sessions. I was figuring stuff out for myself. And then the year started over. And I had 3 sessions. And during the 3rd session, my therapist said, "I'm so sorry to tell you this, but your insurance started over, so your deductible started over, and you owe me $500. So I'm like, well, I need a therapy session to like go through this, to like, like, so it's really hard. It's hard finding resources. So I guess it's just like inquiring about them, speaking up and like saying like, this is bullshit. Like, we should have the right to be able to be mentally well, and we should be able to obtain those resources in a way that, doesn't make us feel stigmatized, doesn't make us feel weak, doesn't make us feel like we're broken, in a way that, I need help. And so I'm going to find help today because I'm having a mental health crisis. And there's hotlines that you can call, there are things that you can do, but I really do think that a lot of maintaining your mental health is by establishing a routine. And some of those things are just out of reach. Therapy is out of reach for a lot of people. So inquiring with other people who, live in similar ways as you, have similar needs as you, and find out what they're doing. Like, maybe they know of a free service. That's what I did. I mean, we're talking about living in our authentic self. I went on Facebook and said, like, I need a therapist now. How do I do that? And then so, when people answered me and they gave me some resources, which, helped me in that moment, I did need that. And so when you're in a place where you don't really feel like you have the safety or you have an environment where you can be that vulnerable, it can be very challenging, because then you have to navigate the system by yourself. And the system is messed up, man. It's messed up. So keep bitching about it and talking about it and having conversations like this, and, just advocating, speaking up, letting people know.
Yeah, couldn't agree more. I think it was just so well said, because our system is messed up. And but I think in every space we're in, and I would say to anyone listening to this, we all need to be advocates for that right to mental health. Just like we say, healthcare is a right. Let's in our minds and in our verbiage, let's include mental health care in that. I think we have to all be advocates and fight for it, each in our own way. We all can't do it all, but advocating at the policy level. In politics, I think even with our representatives, Congress has say about some of this, our health departments, but also, as Heather's saying, to not be afraid to reach out, because there are resources out there. Let's face it, people will struggle to get the best mental health care they can, but let's get, whatever mental health care is available, whatever resources are available, and, ask and not be afraid to. The more we can normalize that we all need it, I think is important. But again, whatever space we're in, let's all try and be advocates for this.
I couldn't agree more. I want to thank my guests, Heather O'Connor and Dr. Robert Remian, for joining me today on this important topic. It's important that we take care of ourselves. If we're duly diagnosed, whether you've been living with HIV for a long time, it's important that we find ways to take care of ourselves, and especially our mental health, with everything going on. As important it is to take care of ourselves, if you or someone else are in crisis, you can call or text 988, and you can reach a crisis hotline to help you. Thank you for joining us.
Yeah, thank you. And thank you for doing this and for being here for us all. Yeah.
Thank you both.
HIV Connect is made possible through educational grants from Gilead Sciences and Merck & Company, which has no influence over the podcast series topics, content, or speaker selection. To learn more about today's topics and other subjects, visit AIDS InfoNet at www.iapac.org/support/AIDS-InfoNet, or click the link in the show notes. As IAPAC's Senior Advisor on Community Engagement, I want to hear from you. You can email me at kpugh@iapac.org. You can also find out more about today's guests in our show notes. Until next time, please be kind and take care of yourself and each other.